You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by ONS member Cecily Snyder, Transplant Case Manager of the Blood and Marrow Transplantation Program at Nebraska Medicine in Omaha, and member of the Metro Omaha ONS Chapter, to discuss CAR T-cell therapy and how it changed approaches to cancer treatment and patient management for oncology nurses. Thanks for joining me today, Cecily.
Thank you for having me. It's great to be here.
I'm not sure if people who are listening to us today know this, but CAR T-cell therapy was the subject of our very first episode back in October 2017. And that seems like a long time. What can you tell us has changed about this treatment since then?
2017. Wow, that feels like that has gone by so fast. We first started establishing our CAR T-cell program. We were only working with about one commercial product in one disease, and that disease was diffuse large B-cell lymphoma. And now we have added a few more commercial products and are working with not only the DLBCL, but also mantle cell lymphoma and B-cell ALL. I can only imagine in the next few years how many more disease types CAR T-cell therapy will be able to be used for, and that's very exciting.
That is exciting. Some people may think, only 4 or a couple of treatments, but the number of patients that now have another option for a treatment is probably just monumental for those disease types, actually. So how is CAR T-cell therapy still revolutionizing cancer care today?
CAR T-cell therapy is giving a chance for so many patients who may not have had the option before. And research is showing us that this therapy can be used in many different instances and different diseases, and it's really promising to see those results. As we look ahead into the future and what research in CAR T-cell therapy is discovering, we may see more disease types being able to utilize CAR T. And as you look at different institutions and their clinical trials, you'll find that many are looking at using the T cells to target certain tumor markers on different cancer cells in solid tumors. And that is quite revolutionary. Clinicaltrials.gov gives a comprehensive list of what may be out there in terms of CAR T research. And I know we have a lot of different studies within our institution, and we're looking at different disease types with CAR T, and even looking at transplant, bone marrow transplant versus CAR T-cell therapy.
Wow, that is amazing. And it's very exciting. As you said, the clinical trials that are happening and the fact that they're looking at more diseases and not just the hematologic diseases, but some solid tumors as well. A lot to come on that and options that are going to be out there. So you mentioned at the beginning when we talked about what has changed from 2017 till now that in 2017, there was really just one disease type that was approved and eligible for CAR T therapy. What patient populations or diagnosis are eligible for this treatment, and what are some of the eligibility criteria that patients would have to meet to receive this treatment?
Yeah, so for commercial CAR T products, it really all depends on the particular disease. Some products are very specific in regards to the disease, and sometimes even the age of the patient. Some require a relapse or refractory disease after a certain amount of therapy in order to be eligible. In addition to the product-specific requirements, we also want to make sure that the patient is healthy enough to go forward with this type of treatment. And so when a provider is assessing their patients for CAR T-cell therapy, they want to make sure that their heart and lung function are adequate and that they have good performance status. While the patients are kind of being worked up for CAR T, we are looking at an echocardiogram prior to treatment to verify their heart looks good. We're making note of what their oxygen saturation is on room air. And we also want to know that the patients have a reliable caregiver. We do require them to stay within a certain distance from the hospital for a period of time after the infusion. And we do tell the patients that they're unable to drive for the first 8 weeks post infusion due to possible neurotoxicity. So having that caregiver is very imperative. We need to know also that financially, this therapy can work for them. The insurance piece can sometimes take the longest. But we do have financial coordinators that work very closely with the patients and are so instrumental with helping them with that piece of the CAR T journey. There are so many parts in getting a patient prepared for CAR T cell therapy, and we always want to make sure that it's the best option for them.
That's a lot of different things that have to be considered before a patient goes forward with treatment. Not that oncology treatment has ever been an easy thing for patients, but it's not just this is the, disease, this is the treatment, and we'll get started next week. Definitely a lot of different things to consider. Also, can you talk to us about what are the new approvals and indications for CAR T cell therapy?
For commercial products, we currently have mantle cell lymphoma as a new indication, in addition to the diffuse large B-cell lymphoma products and a B-cell acute lymphoblastic leukemia product. We're also anticipating the possibility of a product for multiple myeloma coming up in the future, and potentially different products for DLBCL as well. And I think as time goes on, we will be seeing even more indications for commercial CAR T products. I know that there have been some studies on using CAR T for malignant melanoma as well. And, as I mentioned before, there's just so many different clinical trials going on right now, especially with the use of CAR T cell with solid tumors.
One of the things that I understand about CAR T cell therapy, and we're talking about all of the eligibility criteria that has to be considered for patients, but once that actually is all taken care of and a patient is approved and you start forward with the process and they actually receive the CAR T cells, that there are some adverse events that go along with this treatment. Can you tell us if any new adverse events related to CAR T cell therapies have surfaced since we last discussed the topic?
When we first started to do CAR T cell therapy, the most common immediate adverse events were the cytokine release syndrome, or CRS, and the neurotoxicity. And to kind of review, CRS can cause fevers, a drop in blood pressure, shortness of breath, headache, nausea, body aches. Neurotoxicity can cause a patient to feel confused or disoriented. They may even have difficulty speaking, have tremors, or there is even a potential of seizures as well. And these are still really the most common events that happen to patients, especially that acute time following the infusion of CAR T cells. And so providers are still monitoring the patients in their labs very closely, especially during that time frame. What I think is new is that since some time has gone by from our first few CAR T cell patients, we have been able to see more of the longer term side effects. And that is information that we didn't have much of in the beginning.
Yeah, that's not something that I thought about. But when you do think about new treatments or treatments that we've seen and have a lot of experience with, we do see what those long-term effects are and are already prepared for knowing that this treatment, whether that be a chemotherapy or some of the immunotherapies, that we've had enough long-term experience with them that we are already looking out for those kinds of long-term effects. But I honestly hadn't thought about it that way, but that's a really good point. So what are some of the long-term adverse events that you are starting to see with these patients?
We're starting to see that some patients are experiencing prolonged cytopenias. They might have a low white count for some time, and that may require growth factor. Also, it puts them at a greater risk for infection. Some may have low hemoglobin or platelets requiring either blood or platelet transfusions, fatigue, hypogammaglobulinemia. They may require IVIG infusions, orthostatic hypotension, which may require medication, decreased appetite, weight loss, GI complications, depression, anxiety. all of this is something that we're taking note of because it offers valuable insight on what to educate patients on in regards to the long-term side effects.
Thanks for that. I think that's really good to know and understand. Now that we know that, what do oncology nurses need to know about managing those and other adverse events from the CAR T therapies? Are there specific things that would be important, or are there different ways for oncology nurses to address these adverse events than, even with pre-medications or things like that maybe are different from traditional therapy?
I think that in the acute time frame after the CAR T infusion, watching patients very closely is important. The adverse events like the cytokine release syndrome or neurotoxicity can happen quickly and sometimes randomly, but most commonly it will happen a few days after the infusion, but these symptoms can appear weeks later. So educating the patient and the caregiver on these side effects is essential because if they're discharged and sent home, they could very easily have symptoms of CRS or neurotoxicity, and it's important that they have prompt medical attention in order to prevent things from getting worse. Another point to make there is that some places are doing their CAR T-cell products outpatient, so making sure that the patient and their caregiver know what to watch out for and when to call is very significant to discuss.
So one of the things that I have heard in a presentation that I watched about CAR T cell therapy was with the toxicities and especially the neurotoxicities. And you were talking about educating the patient and the families because some of these toxicities, while they can be acute and right after the treatment, there are things that can happen several weeks down the road when they're not inpatient or in the clinic. And it was talking about the neurotoxicity and how you can teach the family member to ask the patient to either write their name or maybe draw something like a square, something easy, not a nice drawing or anything, but just something easy for them. And you can ask them to do that either like every 4 hours or once a day and see if there is any degression in how that looks in what they do. And that will help tell the family member that they really need to contact their medical team and that there might be something going on. And I just thought that was an easy thing to do to watch for those neurotoxicities.
Exactly. And sometimes that's the first sign that something could be going on too.
Exactly. And not something that you would think of, or, it's just really easy to have them on a same piece of paper. Like today we're going to write your name, or today, draw that square for me and let's see how that looks. So I thought that was really interesting. So good takeaway. So as we're talking about this, to me and my understanding, CAR T cell therapies falls under the umbrella of cellular therapies. But for those listening today, can you explain what all cellular therapy encompasses and how many different treatments that actually is talking about?
Cellular therapy is kind of sort of a general term for many different types of therapies. Some of those are the CAR T cell therapy, utilizing the T cells to fight the cancer. There's bone marrow transplant, which utilizes high doses of chemotherapy, followed by either an infusion of the patient's own stem cells or donor cells. And those cells can be obtained either peripherally by peripheral stem cell collection or by bone marrow, which is harvested from the bone. And with transplant, there's a few different types of transplant. Autologous, meaning the patient's own cells. Allogeneic, which are donor cells, and those can be related or unrelated. Syngeneic, which is from an identical twin, or haploidentical, which is a half match. DLI, or donor lymphocyte infusion, is another type of cellular therapy, and that can be used after an allogeneic transplant, in some cases assisting with engraftment or managing a relapse. Tumor infiltrating lymphocytes, they're still in studies, but I do believe some commercial products could be coming very soon. This list doesn't encompass all cellular therapies out there, but I think it shows that if a patient said that they had a cellular therapy in the past, it's significant to ask and see which treatment they have had.
That is a lot of different therapies that fall under that umbrella. And I do agree with you. It could be the patient is going back to their home oncologist that might not be close to the center where they receive their cellular therapy, or maybe even moving out of state to a new PCP or a new oncologist, and how important it is to understand that there are so many different terms that fall under that, and to know to ask that question to try to get a little bit more information from the patient. But speaking to that, you talked a little bit about how they may be inpatient for that immediate time frame when they are given this CAR T cells, but then they may not stay in the hospital too long after that. So they do stay in the area, but then they're going to have to go back to their referring oncologist or to a PCP. So tell me, what do oncology nurses outside of the blood and marrow specialty need to know about CAR T cell therapies for their patients that either they're referring in or will be coming back to their practice after this therapy has been done?
I would say that CAR T cell therapy is very complex, and we might be able to predict what patients experience in regards to side effects from what we've seen, but every patient is just a little different. For the commercial products, we do have the patient stay close for a period of time, and that's usually when the most adverse events can occur. However, things can still happen once they return home. And so we are really educating the patient and the caregiver on what to watch out for and when to call. For example, if they start to experience confusion or something just doesn't seem right to the caregiver, we would want them to call and bring the patient in to be assessed for possible neurotoxicity. And we always say that if a patient were to go home to their home doctor, and if their providers or their nurses had any questions, they can always call the facility where the CAR T cell therapy occurred, if they have any questions or any concerns of, could this be related to CAR T or is this something else? And we also encourage the patient to keep their wallet card, a CAR T wallet card, with them at all times. And this is something that they get the day of infusion. It just has all the information on what product they got and what day they got it. And this card lets their providers know that they've received that treatment. And we tell patients to notify all their healthcare providers that they have received CAR T cell therapy, just so everybody was aware. Another thing to point out is that once patients go home, they may be requiring frequent lab monitoring. If they're experiencing those low white counts or low hemoglobin or low platelets, and they're needing blood products, that might be something that they're having managed at home as well.
That's good. I think it's really important for them to be able to understand that. And the patients are so knowledgeable, especially when they are getting these kinds of therapies, and can take that information back. But just to have those conversations with those nurses kind of one-on-one, so that they know and they feel a little bit more involved and educated about what those patients need. There's so much to talk about and to understand about CAR T therapy. And I would imagine that it takes a lot to set these types of programs up, that they just can't have one day somebody comes in and says, oh, we're going to be starting CAR T cell treatments, next week. That there's a lot. Can you talk about how your facility developed the program?
Yeah, we had approximately about 6 months of preparation to develop our commercial process. And we really utilized our knowledge of the bone marrow transplant process that we already had, and we used that as a foundation. We took our clinical trial data and the commercial product specifics, and then we developed our process. There was a lot of collaboration among different departments, such as social work, our educator, cell processing, apheresis, billing, insurance, IT. We wanted to make sure that we were able to get that CAR T information within the patient's chart and have it pop up that a patient had CAR T cell therapy. So we had a lot of people kind of working on this together. And so we developed weekly meetings to assist with the planning. And then we took all the specifics and mapped them out into an easy to follow process for our nurse case manager. This was helpful in organizing the tasks that needed to be done. And each commercial product has a specific process because we're just a little different. And so we developed a flow sheet as well with the process that the nurse could check off tasks to make sure nothing was missed. And this was also really helpful because if another nurse case manager was helping cover They could just jump right in and there would be no delay in what was needed next for the patient. And they could see what needed to be done in the future and what has already been done. So it was really helpful. And, with each new product we kind of look at our general process and make specific changes and related to that product. And, as new updates come out for the CAR T-cell products, we update the process to reflect those new changes.
That's a very involved setup that needs to be done. And so I can see why it's not something that you can say, oh, we're going to start next week. There's a lot of pieces, and to put that puzzle together and to get everybody involved in it that needs to be involved. We talked a lot about all the different things with CAR T cells today, and I just have a few questions left for you. First of all, what are some misconceptions about CAR T cell therapies?
A common misconception is that CAR T cell therapy can be used for generally any type of cancer. And while research is being done in many different diseases and solid tumors with CAR T, the commercial products that are out there right now are very specific in their eligibility requirements, and patients must meet those in order to be able to receive it. But if a patient were to call asking about CAR T cell therapy, unsure if it could be used for them, I always encourage them to talk with their provider, because with all the research that's going on right now, it's very possible that it could be considered for them.
That's a good thing to let people know. And I'm sure so many of our patients and, their concerned family members are looking all over the place and all over the internet for something to help their family member or to help themselves if they're the patient. And, they see these new types of therapies. And so they just want to latch on to something new and that might have more hope for them. And so it's really important to understand that they are very specific on what the approval has been and how they can be administered. So another question, what is something about CAR T cell therapy that's not often discussed, but you wish people knew more about?
CAR T cell therapy is doing amazing things in cancer care. However, with that therapy, there can also be quite the financial burden that goes along with it. Sometimes insurance approval can take time, and that can mean a patient may have to start on more therapy, or there could be unexpected costs for the patient and their family. Like I had mentioned before, we do require the patient and the caregiver to stay near the hospital for about 4 weeks following the infusion. And that's in addition to the time before the infusion when the patient has to come into town for the collection of the T cells. And then they have to come back for the lymph-node depleting chemotherapy before they go into the hospital to receive the CAR T cell infusion. So those costs can really add up. And if the patient doesn't live in town, they have to think about, travel, lodging, food, in addition to financial responsibilities at home and the cost of the treatment itself. And that can be really stressful for the patient and their family.
Yeah, those are so important to think about. Listening to you talk about that might sound silly, but the word that comes to mind to me is collateral, the collateral issues that need to be taken into consideration for these patients, because it's not just the treatment. And the treatment is a very expensive treatment, but it is all of those other pieces that really need to be considered before getting that approval. And is this going to be doable for a patient, or that financial toxicity that is so often talked about now with patients and treatments?
Absolutely.
And lastly, what are some resources for nurses who want to learn more about this topic?
There are so many great resources out there on CAR T cell therapy. ONS has some great educational resources and articles. The Leukemia Lymphoma Society has some really helpful videos. Clinicaltrials.gov has information on trials that are going on for CAR T. NMDP, which is the National Marrow Donor Program, has a few references. ASTCT, which is the American Society for Transplantation and Cellular Therapy, and the CIBMTR, which is the Center for International Blood and Marrow Transplant Research, are two really great resources as well.
Yep. After talking to you today, that's very important, I think, to have those resources and know where to go, both for nurses who are working in centers that are starting to do these therapies, as well as nurses who are referring patients to centers like yours for the therapy, to be able to understand, their patients are going to be going through, so that they can understand it and also help start that education with the patients when they hear that their patient might be eligible, or they just get a patient asking about it. I think it's really great to be able to know where to go to get those resources. So do you have any final comments for us today?
As CAR T-cell therapy continues to grow and evolve, this is so exciting in the world of oncology because it offers more opportunity to patients who may not have had anything else. And it has been so amazing as an oncology nurse to see all the new advances and treatments that have come available to our patients over the years, and CAR T therapy being one of them.
I agree with you. It's an exciting time. It's just so neat to see how the landscape of oncology treatment and therapies it changes, ever changes, and it's changing fast. So we definitely need to understand and know what those things are for our patients and their families. Thank you so much for joining me today and for your expertise in this area.
Thank you so much for having me, Stephanie.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.